Now, to treat malnutrition, you need to know that we're going just to use the WHO the management protocol for malnutrition, and WHO management protocol is going to be based on these 10 other complications. You need to treat hypothermia. Treat hypothermia by covering or shielding the child basically into blankets. Basically, that's how you treat hypothermia, or you give him warm foods. Now, the next one is to treat hypoglycemia. You give to treat hypoglycemia, provided the child is hypoglycemic, you give him 50, you can just give him sugar to suck. Basically, it can be treatment of hypoglycemia. But if the child is lethargic or is unconscious, you can give him 25 to 50 mils per kilogram. So it's 25 to 50 mils per kilogram in an IV bolus. 50 mils per kilogram, and for IV bolus of glucose 10%. Basically, that's how you treat hypoglycemia. You treat hypoglycemia, you give 25 to 50 mils per kilogram IV bolus of glucose 10%. So when you give that IV bolus like that, you now wait. Is it clear? So until the child is going to regain the consciousness, then you continue now with glucose by mouth. Is it clear? That's provided the child is unconscious, give 25 to 50 mils per kilogram IV bolus of glucose 10%. Is it clear? For the random, if the random blood sugar is low and then the child is conscious, you give him just sugar by mouth. Now, when the child is dehydrated, in the case of dehydration, when you have malnutrition, when there's dehydration in malnutrition, you instead give Resomal. Is it clear? That's rehydration solution for malnutrition. You don't give ORS just like that, because ORS is highly concentrated with sodium ion. Is it clear? It's highly concentrated with salt, so you don't just give ORS. Is it clear? So ORS, so you give instead Resomal, because here we are going to have low level of salt. And then we initially said that in case of and we initially said that in the case of a severe acute malnutrition, the problem was that there was fluid retention and salt retention. So you don't want to give excessive salt to this child, is it clear? Because it's going to be retained in the body. So that's why in this case the rehydration protocol is going to be Resomal, and you can add zinc, because there is also zinc deficiency in them. Is it clear? There is mineral deficiency, also zinc. So you do Resomal plus add zinc, and the zinc is 1 tablet. The 1 tablet is 20 milligrams, 1 tablet per day, provided that you're greater than 1 year, and a half tablet per day for 10 days, provided you're less than 1 year. Is it clear? So that's for Resomal. And the Resomal comes in sachet. You put 1 Resomal in 1 liter of water. Provided you don't have Resomal, you want to prepare it from ORS, it is 2 liters of Resomal plus 1 sachet of ORS plus 4 ampoules of potassium chloride and plus 50 grams of glucose. Is it clear? So you see that we don't put one sachet of ORS in 1 liter of water like we usually do in normal children. We put 1 sachet of ORS in 2 liters of water in order to dilute the salt. Is it clear? I put 4 ampoules of potassium chloride. Why? Because here the salt that is much more in these patients are sodium ions, the sodium retention. Is it clear? So you add the potassium ion. Is it clear? And then the last one is that you are going to give also glucose. Is it clear? To 50 grams of glucose. That is generally the local preparation of Resomal, provided you don't have the Resomal sachet. Is it clear? That is for rehydration, for the rehydration of these children, provided that they are hydrated. Now, for the electrolyte, there are different electrolyte abnormalities. All the rehydration for the electrolyte, you just go on the tutorial of prematurity and birth asphyxia. There is just going to be the protocol for pediatric of each electrolyte. Now, the next one, if there's any problem with the vitamins, particularly you supplement them the particular vitamin that you see with a clinical symptom. Infection, these children need to be placed on prophylactic antibiotic therapy, and if there's any infection, you need to treat the infection based on the normal flora. And for you to understand which major antibiotic you have to give, go on the tutorial on antibiotherapy.